We've got standing here today with a fresh ACL recon. This is week 3 post-op. Special one, this one, because this has also got a lateral tenodesis, and I'll explain what that is in a minute. But this is classic ACL, most of it. You've got the port here where they've taken the graft, okay, and where they've screwed in through there for the ACL. You've got your portals here where they have a camera and a tool. You've got your drainage way up here. This one here is the scar from a lateral tenodesis. Now the difference with this one is they use a bit of ITB to stabilize the knee. Now this is quite helpful for either younger athletes or people who've got a bit of instability, and it does show to reduce the rate of re-tear of that graft from about 11% down to about 4%. So interesting one. At the moment, what it will do is give him a little bit of soreness here for the first 3 months, and then it fades off and goes away. And by the end of the 12 months, he's exactly the same on this side as other people, but probably a little bit more stable. What they do with the lateral tenodesis, this is actually the right knee. So if the ITB is coming in on the side, okay, so imagine my ITB would come down the side and attach into your tibia. They take a slip, so they graft a slip of that ITB. Imagine that's the ITB. They take a slip like that and put it underneath that lateral collateral ligament. Okay, what that does is it gives it way more stability on that side and gives it much more rotary stability there. Okay, so there's less likely of re-tear. So you can see that over here. You can see here they've come in here and done that. So you imagine that the ITB has come down here and normally hook in there. What they've done is put a little slip underneath the lateral ligament, all right, so it goes underneath it and then rejoins, and that gives them that stability. They call it lateral tenodesis. So for him, that's created a little bit of stiffness, of course. He's week 3. He's doing really well. When he came in though, he was zero extension, so he came in with absolutely zero extension. Quads were turned off. There's a lot more swelling. The bandages were on. He's got those off now. Now he's at week 3. We've got him off the crutches, got him walking properly. He's way up into 105 degrees, okay, straight away in week 3. And now that's from soft tissue work. He's doing a lot of stretching, okay. He's doing his homework. He's got confidence to do it. And he's just worked on it throughout the week, and look at it, it's gone to 115. He's now able, 105 I should say, he's now able to get on the bike. That's going to give him another 10 or 15 degrees straight away because he's going to loosen it up, and then he's away. A couple of things with this one. You can see his VMO quad here. If you look at his right VMO quad, if he squeezes that one, okay, there's the quad, good tone there, looking great. If you look at this one, squeeze the quad, it's come back. You can see that, so it's already pumped up and going well. Of course, with all ACLs, this quad here, the VMO quad, drops in size, drops in tone for all, but he's bringing that back. He can bring that on and that'll get better and better and better. But a very crucial one for him to work on is to try and make sure whenever he thinks about it at work or at home, he's trying to re-switch that on and get that going, because that'll play a crucial role in his knee rehab. But his knee flexion is going well, but the way he does, and one of the best exercises for him to get that knee flexion better, is he does prone passive knee flexion. So what does he do? He hooks the good leg under the bad leg. So this one here puts it under here. Now this is a really easy, safe way of doing knee flexion that he can control. If he bends his knee with the right leg, he lets this one passively relax. Okay, he can then go as high as he can because he's got a good hamstring on his right. It means he doesn't have to use his hamstring that he's had grafted on the left, and he gets that knee bending. And he just goes as far as he can go, okay? And then once he's got as far as he can go and he feels that tightness, he's then dropping it down. As he goes all the way down, the little added benefit, what he can do is take that off, and then you can push down and stretch that out. So if he's off the end of the bed, he can stretch that out, stretch all this out in between each rep, and then he goes again, pops it under, lifts it up. So it does take away the work of that hamstring a little bit, because we do want that to repair. We don't want to go bananas on that hamstring and make it work too hard just to try and bend his knee. But it's a very nice one for him to work on, and he's already getting up to 105, which is great. The second thing he needs to work on really hard at home is actually moving that scar tissue. So if you look at this scar here, when we move it, okay, you can see how that's stuck down. Now he is week 3, but we want to get that moving, because what that scar tightness there and the lateral scar here tightness does is it limits him in his bending. So when he comes up, if he's stuck down the tissue here, it'll pull on here and he won't be able to bend as much. So if he works on scar tissue mobilization at home by getting in there with a bit of vitamin E cream, something like that, and just pushing it left and right. Can you see that puckering there? Okay, so it's puckers, and when I go on this side, it puckers there. He needs to get in and mobilize this around every day himself, and we do it in the clinic as well. Same with this one here. Get in here. You can see this one's a little bit more mobile here, because this one is more soft tissue that it's stuck down here. This one's getting right down to that sort of bone, so it's going to be a lot more stuck down. You find these ones are always harder to budge than the lateral one. And of course the portals are pretty easy. They feel a little bit lumpy, but they move around okay. So if he can get stuck into this, this will really free him up. It'll not accelerate his recovery, but it just takes off some of the handbrakes of him getting his knee bending, which will then just keep him on track throughout the program. He's doing a lot of stuff this week, but the third thing I want to show you is his one-legged stance. So he's got to get good at balancing on one leg. He's got to get good at shifting weight on one leg. Before, last week, he was on crutches and he was sort of partial weight bearing. So weight bearing for him is a little bit scary, but he's got to get good at it. So one of the exercises that helps him with walking and load bearing is standing on one leg. Now, if he stands on his left leg and balances there, what we've got to make sure of, you just try that for me, Stan. He's got to bend his knee, right? So he doesn't stay there with a straight knee, he bends his knee. He bends his hip, so he's flexing the hip, so he leans forward a little bit, takes his other foot off the ground. What he's got to get good at, if you watch his knee, see how it shakes a little bit, all right? He's got to get good at controlling that knee and keeping it super stable. And he might do 10 seconds at a time like that, put the leg down. He's aiming for 30 seconds in total. He's aiming for about 4 lots of that. Okay, so when he does 10 seconds, he's got to do another 10, then he gets to 30, he's got to do 4 of those. But he's also got to make sure he doesn't let his knee roll in like that. That's the big one we want to avoid. We want to get the knee out over the middle of the foot. Now the middle of the foot is between like the second and third toe. Okay, so when you look at, if he looks down, if he's in shoes, he's going to look at his laces. He's got to get the middle of his kneecap directly over his laces or the middle of his foot. So when he stands on one leg, do that for me, he's got to try and stop it rolling inwards. So if it ever rolls inwards, he's got to keep sort of thinking about pulling this knee outwards without falling over. Try that again for me, Stan. Keeping the knee bent, hip bent, trying to let the knee come outwards a bit more rather than go inwards. That's going to fire him up in his hip. It's also going to get a lot better movement patterning. You see that little roll there, a lot better movement patterning for his general walking, his sit to stands, squatting, all that sort of thing. So as we know, in week 3 of a program, you're doing a lot of exercises. The last one I do want to show you though is what he's doing for his knee flexion and standing, which is actually for his hamstring. Now, when he walks, what happens is he's not bending his heel high enough when he walks. Okay, we really want him to bend his knee. Now, some of that is the stiffness in here, some of it's confidence, some of it's the hamstring not really firing very well. So what he's trying to do, if you stand right leg for me, there, Stan, he's trying to bend his knee up and do an isometric hold of the hamstring. Okay, so bending his knee, bending as high as he can go for 30 seconds without cramping the hamstring or causing any problems there, to try and get some tone up in that hamstring. That will give him more knee flexion as well, but also give him a bit more sort of brain to hamstring power about getting my knee higher. Okay, and this is the isometric stuff that he's going to do, not just for walking. He's going to do it because he's got to enter into hamstring eccentric training down the track. You're best to start with the isometric work in a functional position standing. So that will then program us along. And the good thing about that is hopefully the more tone he has, the more confidence he's going to get. When he walks, he's going to be able to bend his knee a little bit more. That repetition is going to help with his range. So it's a really good one for him to do as part of his week 3 program, because it's so beneficial for him. Right, we're going to follow Stan throughout his journey, and he's also going to be in our ACL rehab program online at physiorehab.com. So look out from there, look out from online, and we'll see you soon.